improving immunization data collection, quality, and use for better decision making. Then we have Professor Bajira Sanayake, who is Dean, Faculty of Medicine at the University of Colombo, and also founder, chairman of the Commonwealth Center for Digital Health, which serves to support and promote digital health globally across the Commonwealth of Nations. Following him, we have Dr. Karine Kalanda, who is Senior Health Specialist in the Implementation Research and Delivery Science Unit in the Health section at UNICEF. She is the global lead for digital health and is responsible for coordination, planning, management, and evaluation of data and digital health initiatives for child health and health systems strengthening programs. And then lastly, but by all means not the least, is Sylvia Wong, who is Innovation Lead for UNFPA, which is the United Nations Population Fund. She leads global innovation activities, manages partnerships, and advises on investments towards sourcing, implementing, and scaling up of new solutions, including digital and data innovations for women, girls, young people's sexual and reproductive health. We have quite a good number of speakers that will help us break down, help us synthesize this particular instrument. And so without further ado, we actually are going to go into the discussion, and beginning with Dr. Garrett Mell. Dr. Garrett Mell will give us an overview of the instrument, the DIIG code in short, and will give us an orientation on the content of the instrument so as to appreciate the high-level nature of the document. And so I'll be calling upon Garrett to take the floor and lead us into this short highlight discussion of the instrument. Over to you, Garrett.
Thank you so much, Derek. I am just setting up a share here and just want to confirm with others that they can see. Okay, great. Really, and it's an honor to be here and to share with you the launch of the Digital Implementation Investment Guide. This document is a complement to the guidelines on digital health interventions for health system strengthening that were launched last year. And this document serves as a document that was co-developed with PATH, UNICEF, and UNFPA, and offers an opportunity for countries that are in a situation of wanting to determine what kind of investments they should be making according to the maturity of their country, but also according to the needs that they have. And so I'll go through a little bit of the overview of the document and also point you to the specific location in which you can develop the guide, download the guide. So feel free to please go to this page and feel free to download it within your own when you have time. I will be really talking about the situation that I think many of us have faced, and many countries have faced as well, in recognizing that a lot of partners and a lot of countries have really seen a plethora of investments into projects that have a single purpose and are oftentimes deployed, and at the end of a project they end, and they oftentimes only serve the purpose of the project. This guide really helps a country to determine what kinds of investments are needed to ensure that they can move beyond the project and actually get to the full health sector, so that each investment that is made into their digital health ecosystem both benefits the specific program area, but also benefits the entire sector, and is intended to cumulatively add value across the sector, so that each investment is sustainable and institutionalized and can meet the diversity of health sector needs that digital health can help help them augment. It recognizes that each of these investments are within an ecosystem of strategy at a national level for health, also ideally a digital health strategy, and recognizes that a country will have an investment plan, and ideally will also have an understanding of the vision for their country around the different kinds of investments that they wish to make and the kinds of systems that need to interoperate within an exchanged environment. It gives advice and helps a country to systematically go through the process of ensuring that they have all of the different building blocks in place. They have governance, and they're thinking about the data use culture, and they're helping to ensure that whether it's health workers or systems or managers or individuals in the system, they're able to make use of the digital tools and to maximum benefit. Thinking about standards and interoperability, the different services and applications, the infrastructure, the workforce, and other elements that are critical to ensuring scale, sustainability, and benefit from digital health. It addresses questions of which systems should I invest in to address different programmatic needs. It ensures that countries are thinking about capacity to not only to implement, but also to gain and benefit from the cyclical nature of digital, of benefiting and strengthening value over time through change management. It also helps countries to ensure they're able to govern effectively and prioritize those investments. It also helps to ensure that there is a data exchange environment that's supported by standards. The DIIG fits into an ecosystem of many other tools that are out there, recognizing that there are many steps in the kinds of investments that countries need to make. The DIIG tries to address a number of these phases and helps to situate this guide within a set of other guides that are within the ecosystem so that other guides can be leveraged over time. It goes through a 9-step process, and each chapter helps a country to identify what inputs and what outputs they benefit from, so that in the end, through this 9-step process, they're able to develop a costed implementation plan that is developed according to and in line with the maturity of their country and the ecosystem of digital tools that are and policy environment that the country is facing. And in the end, it provides a template for developing that costed implementation plan, recognizing that some countries or some partners will come in at different points and use different parts of the document. But in the end, there is true value in helping to establish an implementation plan for internal investments from the government or from donors that may be also wanting to play a role in investment and can help to coordinate those investments in an effective way. Recognizing that there are health goals that need to be articulated, that there's a digital context, and that there are financial and operational considerations. I just want to stop and thank all of the colleagues who've been a part of this document, co-authoring it over the last several years. It's a document that we hope meets the needs of both member states, implementing partners, investors, and the coordination aspects that are required. We've included a Slido link here, so in case you have questions, please go to this Slido and enter event code /DIIG and rank and write questions, and by the end, we'll be able to have a discussion around those questions. Thank you.
Thank you so much, Garrett, for that historical landscaping and that summary in terms of the features of the instrument, and also for highlighting key issues around governance, how the instrument helps us to strengthen national governance of digital health, issues around multi-sectoralism, making sure that there's a whole of governance approach and the stepwise approach towards strengthening digital. I think as we are really at the thresholds of deploying the global strategy, these issues are quite key to actualize the global strategy and also to strengthen member states' digital health actions as described. I would like to now go into a discussion with the other speakers around some of the use cases that they see this instrument would provide. And so I'll be turning to Lori Werner from the perspective of what the instrument, the DIIG, means when it comes to practical application, and also some of the use cases based on the BID initiative. And so, Lori, if you could really talk to us about your reflections, including also how the DIIG would, could sort of like strengthen, life cycle management for projects, and any other use cases that you see as value propositions for such an instrument. Lori, the floor is yours.
Thank you very much, Derek. And hello, everyone. I'm Lori Werner, Director of Program at PATH's Center of Digital and Data Excellence, joining you today from Seattle, Washington. First of all, I'd like to thank you for the chance to celebrate today's launch alongside my esteemed colleagues. And also I'd like to thank the many partners and contributors who made the Digital Implementation Investment Guide possible, as well as DIAL and the Bill and Melinda Gates Foundation, who recognize the value of sponsoring the guide. Today, it's nearly impossible to find a health worker who is not connected with technology, whether it be smartphones or tablets or messaging platforms. And so faced with this digital revolution, we have an opportunity to further optimize these digital innovations that can save health workers time, they can reach more patients in need, conserve precious health budgets, and deliver better care. So with this in mind, PATH's Center of Digital and Data Excellence is very pleased to have contributed to the Digital Implementation Investment Guide, which can help us all maximize resources and make best use of our new technologies. So many of the practical tools and approaches that are captured in the DIIG were informed and reinforced by PATH's own learnings. The DIIG, for example, drew upon the learnings of the BID initiative, as Derek mentioned. We worked with the governments of Tanzania and Zambia to design, introduce, and scale up electronic immunization registries that now include the vaccine records of more than 1 million children. The registries help health workers ensure no child misses a life-saving vaccine. BID's learnings around the importance of country-owned and country-led digital innovations helped inform several core tenets of the DIIG. Through early consultation meetings, design summits, and visits to health facilities, PATH worked with the countries to define the opportunities and the key challenges faced by their immunization programs. And this approach to prioritizing health system challenges and user-centered design is a core principle of the DIIG. BID's learnings around sustainability are also prominently reflected within the guide. For example, in Tanzania, PATH has been working closely with the government to transition this electronic immunization registry from the country's legacy paper-based system to a fully digital system, which they expect to scale nationally by the end of 2021. This commitment to building for sustainable, long-term digital health programs instead of one-off pilots is also core to the DIIG. The DIIG provides a stepwise approach for identifying and implementing digital health interventions, guiding users on how to build digital health systems that are appropriately aligned to countries' needs and digital maturity. And PATH looks forward to continuing to apply its guidance to our current and future digital initiatives. We are thrilled to see the DIIG launch today and to see the diversity of actors participating in today's launch. From funders to implementing partners and country representatives, we all play a role in growing the collaboration and coordination of the digital health sector. And at PATH, we are committed to championing the principles and approaches defined within the DIIG. We pledge to advance digital health interventions that are country-driven, designed for scale, and appropriately aligned with the needs and technical maturity of each country's health system. The DIIG will help catapult digital health to the next level and serve as a tool of health equity. Thank you very much.
Thank you so much, Lori, for those remarks highlighting a number of use cases. including the need to really focus on country-driven programs, and also really being outcomes driven, including issues of reaching out to more people through digital transformation, which is a core pillar of universal health coverage. We'd like to call upon to the floor Professor Bajira Sanayake to give us some of the reflections from the Commonwealth perspective, and also some country examples as it relates to how the DIIG relates to the Commonwealth experience around digital health transformation. Professor Bajira, the floor is yours.
Thank you very much. It's indeed a pleasure to be here today in this important launch of the Digital Investments Guide, which is a fantastic document. I went through it during the past few days, and what I saw was kind of music to my eyes, because when we began our journey in digital health, what was called e-health at that time in 2008 in Sri Lanka, we had none of these guides and tools at our disposal. So we embarked on a strategy of developing doctors who were competent in biomedical and health informatics. And along the way, they picked up the tools that were necessary to equip them to strengthen our health system with digital technologies. The path that we took at that time made it necessary for us to embark on what we called frugal innovation, low cost, highly effective, scalable, and sustainable products that went into strengthening our health system. And the learning that we got from that, of course, was what I took to the Commonwealth when I took over as the president of the Commonwealth Medical Association in 2016, and set up the Commonwealth Center for Digital Health in 2018. Our experience in Sri Lanka showed that we have to have local capacity. So we, in the past 10 to 12 years, have produced more than 200 doctors with masters in biomedical informatics, and some of them have gone on to do MD and become board certified consultants in health informatics, leading the implementation of digital health technologies in the country. And what has happened as a result of that learning, which collectively grew to the development of the digital health ecosystem in Sri Lanka, was that we also worked in the past 2 years with the leadership of the Ministry of Health on aligning our work, the tools that we were deploying, in a way where the funders and the international development partners could align with us. So in a way, we did something which probably a lot of countries did not do. And today, because of that, we have the tools, scalable, low-cost tools developed on open source platforms that we scale up in collaboration with international development partners. So the guide, when I went through the guide, I really saw in a way a chronology of what we did encapsulated in one document, and I have no hesitation in recommending it for any country who's starting on the journey now, because it is really a very useful guide. Talking briefly of the Commonwealth, the learning from what we had in Sri Lanka, taking to the Commonwealth, was that most countries are really struggling, if I may use that word, to move from the tools that are used in a specific program to tools that will really help transform their country's health system digitally, transform and strengthen their health system digitally. In that context too, the guide is a valuable document, and I think I would definitely recommend it to all Commonwealth as well as beyond ministries of health innovation leads, so that they could use it as a guiding as a guide which will really take them to where they expect them to be. But of course, I must, as the last point, highlight the fact that this is a long-term journey. We are faced with the corona pandemic, COVID-19 pandemic, but that presents us the opportunity to accelerate the work that we do. So therefore, I would say seize the opportunity, get the policymakers and the decision makers on board, engage the international development partners, deal with the short term, but looking at the long term of developing digitally enabled, sustainable health ecosystems, and that basically deliver effective and efficacious healthcare for your populations. So with those words, once again, thank you very much for your invitation this evening for me, this evening. I look forward to continuing engagement with the WHO on future activities. And it's always a pleasure to be at your events. Thank you very much.
Thank you so much, Professor Bajira, for those key remarks and reflections, especially your emphasis around digital transformations and health systems strengthening, including the need to really focus on our ability to produce responsive, resilient health systems that are able to withstand shocks, such as what COVID-19 has taught us. Those are key remarks, and the use case around Sri Lanka is quite useful. We'll now turn to Dr. Karine Calendar, who is going to give us reflections and experiences of using some components in the DIIG instrument, and linking this also to community health platforms and strengthening health service delivery. Karine, the floor is yours.
Thank you so much, Derek. So at UNICEF, we're also very, very happy to have been part of this process to develop this very important document, which we are very big fans of ourselves. And at UNICEF, our main health priority is for every girl and boy to survive and thrive. And we do this by supporting primary health care and strengthening health systems at the core, and this to achieve universal health coverage. And in the 192 countries where we have programs, we work very closely with country governments to identify the priority health conditions and the priority health interventions that can address these conditions. And our health system strengthening approach typically takes a bottleneck analysis to understand where there are service delivery gaps, and then work with technical experts and partners to identify the most promising solutions to overcome those bottlenecks. And this, for us, is where digital health comes in. And we're using our digital health for primary healthcare approach to guide governments on how to identify when and where digital health solutions can be introduced in order to overcome some of those bottlenecks and strengthen the health systems in the process. And a substantial focus area at UNICEF is to strengthen community health systems in particular. And community health programs typically integrates the delivery of preventive, promotive, and curative care through a community system. And for these systems to function well, we need these programs to have well-trained and well-supported community health workers, procurement and supply chains that don't break down, governance and financing strategies that are sustainable, and information systems that generate the data that can be used for action and insight. And all these are areas where digital health can be really useful. And here is where we see the DIIG coming in. We think that, we find it incredibly useful as a resource to design, that has been designed specifically to support the teams to articulate the health system bottlenecks while reviewing existing in-country digital health solutions and choosing the most appropriate solutions that have the needed functionalities to address the challenges that have been identified. And it will walk the user through selecting and planning and costing and implementing the solutions that are then aligned with the identified needs, and make sure that these are appropriate for the country context and the existing technologies that they need to integrate with. So at UNICEF, we have already started using this guide. At the beginning of this year, we started supporting countries to plan their digital health investments following the structure of this guide. And for example, in Western and Central Africa, we have teamed up very closely with the World Bank team led by Miki Chopra to provide dedicated technical assistance to a number of countries in the region. And the teams we work with there, both at national and regional level, are using the DIIG to work with the governments to make strategic decisions and to develop investment cases for national digital health implementations that are embedded into their community and primary healthcare strategies. And while countries now introduce digital health to operationalize national e-health strategies, and with national commitments to universal health coverage, primary healthcare, and community health roadmaps, I think the timing of this DIIG to facilitate this planning process is just perfect. And I'm really looking forward to working with other stakeholders in the global digital health community to coordinate our support better to countries, and applying this resource to support the planning and development of sustainable health strategies that use appropriate digital solutions embedded into them. Thank you.
Thank you so much, Karine, for those critical and key reflections around alignment with country priorities, topics to do with making sure that we're holistic, including preventive, promotive, and curative services, and also bottleneck identification, leading countries to identify the appropriate solutions where digital might be relevant, and many more, including universal health coverage, the need to focus on primary healthcare services. We'll now turn on to our last speaker before we go into the question and answer session, Sylvia Wong, who will be really speaking to us on a particular use case and use cases on how the DIIG would be applicable to sexual and reproductive health services and relations to, and actually linkages to the SDG gap data and digital accelerator mechanisms, and many more use cases in that particular direction. Sylvia, the floor is yours.
Thank you very much, Derek. And good morning, good afternoon, and good evening to all of you. On behalf of UNFPA, the United Nations Population Fund, it has been indeed a distinct pleasure and a privilege to contribute to joint efforts with WHO and all the other entities involved here to the DIIG, and which we're very excited to be part of this launch. And as we know, UNFPA, as the sexual and reproductive health entity, we know that sexual and reproductive health is an essential part of overall health and well-being. And when we think about our own ability to decide whether, when, and how many children to have and with whom, having access to that information and services to make the best informed decisions for ourselves is part of a strong and functioning health system, and as part of universal health coverage. And this is why an integrated approach to digital health is so key and crucial, as exemplified in the DIIG. We know that digital supports innovations in healthcare delivery. And even before COVID-19, we saw that digital has powered the self-care revolution in sexual and reproductive health for women and girls and youth around the world. And it has helped streamline data collection in this area, as well as helped our healthcare workers to deliver the best-in-class care. And when I think about the sexual and reproductive health space, in particular, we've seen over the years a variety of efforts powered by digital, whether it's period trackers for girls, sexual and reproductive health apps for young people, ANC reminders for pregnant women, job aids for outreach workers and midwives, or family planning inventory checklists and supply notifications. We've seen that many of these efforts and examples have important lessons to learn, have helped to support and improve quality and informed decision-making, and have expanded. Yet at the same time, we've seen that many of them have landed in what we could call a pilot graveyard of good digital intentions, but are still very useful lessons to be gained from those efforts. And the DIIG, therefore, really enables us to leverage these experiences to go beyond by providing a systematic approach to integrating sexual and reproductive health as part of health systems and as part of universal health coverage. And it has also allowed us to reimagine better ways to deliver health care for all. And whether it works and for whom depends not only on advances in technologies and health, the availability of strong, reliable, and robust data, but especially the people, governments, and entities behind these efforts. And coordination and alignment are absolutely key. And this is why, as with all the other speakers, we completely are happy and agree that the DIIG is coming at a very opportune time, because we need to align and accelerate joint efforts behind countries' priorities and overcome fragmentation. And this is why the SDG 3 Global Action Plan, a global partnership led by WHO in partnership with 11 other leading health and development and humanitarian entities such as UNICEF, Gavi, UNFPA, the GFF, aims to do that. It's the Global Action Plan has recognized the power of data and digital together as an accelerator for countries to achieve the health-related SDGs. And we know that data and digital technologies are also crucial for the success of other priority accelerators, such as what was mentioned before, primary healthcare, sustainable financing, and innovations within humanitarian and fragile contexts. Country teams around the world can use the DIIG, and it's especially crucial for us to be able to have it as a tool, a global resource, a global good that would enable a systematic framework and digital investment roadmap for all of us to be able to align, accelerate, engage partners, and coordinate for healthy lives everywhere in this new digital age. So thank you very much, esteemed colleagues, and I look forward on behalf of UNFPA that we commit to working with partners to make this a reality. Thank you very much.
Thank you so much, Sylvia, for those excellent remarks just made, including key issues of coordination and using the DIIG as an instrument to foster that, the linkages between data and digital, and how the DIIG can actually put those two together in an efficient way. And more importantly, topics around patient-focused, being patient-focused and patient-centric, in terms of also using the DIIG as a public global good to foster transformation, not only at a national level, but at a global scale. With these remarks, key remarks and reflections, we'd like to pause and ask the speakers specific questions as raised from the viewers, for which we appreciate for the quality of the questions. And so with the first questions, I would like to turn to our speakers, and maybe we'll begin with Garrett, to speak to the topic of dissemination to ministries. The question at hand is, how would this be disseminated to ministries of health? Would WHO provide monitoring support for countries that wish to utilize the DIIG in implementing digital health projects? Over to you, Garrett.
Great. Thank you so much. And thanks for the question. I think it's a really helpful one. Ministries of health are the principal intended users of this document. And we have been really actively engaging with the technical and financial and implementation partner agencies, even at this early stage, to ensure that they are incorporating this into the set of guidance that they provide to member states to be able to ensure that the applications that they may be making for grants, as well as other requests that they make on a technical basis, is informed by the DIIG itself. We also want to ensure that ministries have access to people in their countries or in the region who have skills and how to use the DIIG to help support them through the process of using it. And so we have been trying to ensure that there's a pool of people who are have experience in already using the DIIG, and we want to make sure that they are adequately aware of it and find the right technical partners for that. The last point I think I'll make is the WHO with ITU has been developing a set of training curriculum that really will help countries build the capacity for planning their digital health systems at a national level. My colleague Derek Munin and others are leading this work, and the DIIG is at the heart of that curriculum. And we're really proud to ensure to have been able to incorporate that into the training materials, and wish to work with the agencies on this panel, but also others in the digital health community to help build the capacity and understanding at the ministry and how to use this guide and others. So thanks very much.
Thank you so much, Garrett, for that. Thank you so much, Garrett, for that useful reflection. Speaking specifically around the questions of country support, and also how do we actually transform these particular topics into curricula so as to provide capacity building activities that transfer the skills that enable digital transformation to be realized based upon the human resources at the national level. I would like to quickly turn for a few questions to Laura and Karine. Perhaps this question might be taken by any of you. The question at hand is, how do we ensure countries do not lose or end up rewriting of past investments, however ineffective these may be? Your reflections? Maybe we'll start with Lori and then thereafter Kari.
Sure, yeah, thanks, Derek. I think that's actually one of the great benefits of the DIIG is that the way it goes step by step, you can actually look at the current, very few places are starting from zero. And so look at what is currently going on in your country, in your context, and really see, is it addressing the challenges? Is it addressing what the needs? And is it appropriately matched to where your the digital maturity is? And help you really see which parts are working and which may not be, and then you could think through adapting and adjusting based upon that. I think it's really hard at times to think that an investment has been made that is just not working, and that's hard to walk away from. And so this is a really helpful, I think it can be a very helpful tool to evaluate which parts are working and what you should keep and what you might need to change, and in a way that will really get, rather than keeping maybe an investment that is ineffective and therefore actually probably costing you more money and not helping you get to where you need to go, keep the parts that are working and adjust to really get to the place where you want to be and to an effective set of interventions.
Thank you so much for that reflection. As we are getting closer to the end of the program, we'll take a few more questions, and then after which we'll go into closing remarks to be facilitated by Mr. Bernardo Mariano momentarily. The question that I guess Garrett would be taking this question as well is, does the DIIG instruct how to optimize from current state of digital health investments to a better state, as most countries will not be starting from zero? Does the guide easily deal with those countries which access a digital technology where access to digital technology is not readily available or implemented, particularly in rural and remote areas. Over to you, Garrett.
Great, thanks so much for the question. I think absolutely, most countries have made investments in digital health, have specific systems that may be in place. They may ideally have a policy in place, and they have experience, and they have they most likely have some failures, and they most likely have some successes. And it recognizes that there's an importance on establishing a vision and ensuring that they're able to articulate what the sequential investments that might be needed in order to ensure that they're able to achieve that vision. It enables a country to leverage a maturity model that, and there are many maturity models that are out in the ecosystem. WHO is working to develop one that brings together all the learnings that that have come from other maturity models and brings something together. But at this point, it recognizes that a country needs to assess where they're at in terms of their readiness and maturity. It needs to, it recognizes that countries need to assess the different interventions and different digital systems that may be in place. And then it ensures that they develop a cost implementation plan that recognizes the aspects that are around getting to national scale, and also recognizes the implementation challenges that may be from rural settings or where there may not be such good connectivity. And so it provides implementation advice around 10 of the interventions that are recognized in the guidelines, but also recognizes that countries will need to plan for and make investments perhaps into infrastructure to overcome any challenges that are identified. So it absolutely allows a country to come in at any point in the maturity model or in the maturity that they may be at. Thanks.
Thank you so much, Garrett, for that reflection. We have a number of good questions coming around how the DIIG ensures safety for digital interventions when implemented, including protecting data from, and also the issue of protecting health seekers from unintended consequences, making sure that applications of AI, how does the DIIG ensure that new innovative technologies such as AI do not produce unintended consequences? I do hope during the director's closing remarks, some of the topics around AI and what WHO is doing, those could be, reflected, will be reflected in the closing remarks. There is some questions around how the role of producers of digital applications, how can these two foster and support and help to expand and magnify the work of developers and producers of these systems. Many of these questions indeed are reflected in the DIIG, and for lack of time, and as we'll be having a second session where we have a deep dive, we hope we can prepare a session that will really be very dedicated, which will be focused on some of these, programmatic issues around, the different actors in the digital health ecosystem. What is their role? What sections of DIIG can they utilize? And frontier technologies, how can this, a particular subject be supported by digital interventions, by the instrument itself? For lack of time, all these will be taken care of in the subsequent session. And so at this point, it's my, again, rare honor and privilege to ask to the floor the Director of Digital Health and Innovation, Mr. Bernardo Mariano, Jr., who is the Director, as mentioned, of the Department of Digital Health and Innovation, and the Chief Information Officer at WHO, responsible also for setting and maintaining the vision and direction of WHO's strategy of digital health, making sure that digital health is placed within the context of health in the digital age in this case. And of course, as a CIO as well, he ensures that the digital transformation of WHO enhances the organization's collective performance and efficacy to deliver the health for all, both at global level and also at national level. Bernardo, the floor is yours.
Thank you, Derek. good morning, good afternoon, or good evening, depending on where you are. On behalf of my team and the colleagues at WHO, I want to thank everyone for joining us today for this official launch of the Digital Implementation Investment Guide. I want to thank also the colleagues that have been behind this, both within WHO and the other agencies that helped us bring this tool to life, this digital implementation investment guide to life, and I'll come to that in a moment. But before going down to talk more about the DIIG, or the Digital Implementation Investment Guide, let me just pause to say that let's not forget the 46% of the world not connected. So there is still close to half of the world that needs that access to broadband to be able to fully enjoy the benefits. Let's not forget about the ethics and privacy issues, and we have some guidances on that as well. But also, let's not forget about health data and all the issues around the monetization and demonetization, or the sharing of health data. So how, and the governance around it. So there are some key elements that we at WHO continue to work on those elements to ensure that we bring our contribution to this ecosystem that is transforming at a very rapid pace, especially with the COVID-19. So we see that the transformation, the digital transformation of healthcare sector is accelerated. So let's not forget those elements. And from our perspective, we are working very hard to make sure that the digital health ecosystem is full with tools, systems, solutions that bring those health benefits that we all want to see. And I believe our discussions today underline the relevance of digital health implementation investment guide, and also underlines the importance of this collaboration and coordinated approach to digital health investments to ensure that we fully reap all the benefits of this digital transformation. Many of you highlighted during discussions and comments the commitment and the commitment and the coordination that is required. Actually, the whole DIIG is a result of that. So we have the partners that work with us, but also many other contributions that we received from many other forums that brought that allowed the DIIG to be released today. So I want to thank both the known heroes, but the unknown heroes that perhaps we are not able to mention, the individuals that have also contributed to that. But this collaboration and coordination is key to ensure that the digital investment is effective, promoting equitable access to health, but also, most important, address the health needs at a very, very local context, because we very easily we can get lost into global, regional, national, but we need to make sure that it makes a difference down to the national level, down to the community level, down to that individual that is sitting at the very remote area that requires tools that will make a difference in the life of these people. So the DIIG is a tool that encourages that strategic collaboration and governance, tools that help decision makers to make ethical and evidence-based decisions with the sustainability and equity at the very core. A tool that coordinates or promotes the coordination with people working across multiple sectors. A tool that makes a case that digital health or investment in digital health must be both effective and sustainable, and ensure that those anticipated health benefits are fully achieved. At the 71st World Health Assembly of WHO, member states requested us to develop the global strategy on digital health to promote guidance for scaling and implementation of digital health in line with the WHO 13 global program of work. So that work is at the core of the Department of Digital Health and Innovation, and lots of member states have greatly contributed to ensure that since 2019, when we start working on the global strategy, we are now going to see that document to be sent for approval to our member states in the upcoming World Health Assembly next month. In 2019, WHO launched this first WHO guideline recommendation on digital intervention. So this current guidance, the DIIG, is really an evolution of that. It's rooted on evidence and guidance which helps countries to effectively establish, scale up, maintain, and evaluate the impact of digital health intervention. Some questions in the slide is alluded for the fact that how can we ensure that the DIIG does complement what countries have already done in this area. So the other tool and that the department is working is the dynamic digital health maturity model, because that is where the combination of the investment guide and the maturity model of the country will ensure that those investments are taking the country from one maturity level to the next maturity level, and ensure that the health benefits are realized through that. So WHO, along with the other stakeholders, we are working to develop that maturity model, and we look forward to perhaps in a more face-to-face atmosphere at some time in the near future, we are able to also launch the dynamic digital health maturity model, which will be part of to complement the DIIG today. We are also working on smart guidelines. Guidelines of WHO today are paper-based, so we want to make sure that we have smart guidelines that are computable guidelines, so a comprehensive set of digital with health components and that are part both in standards, code, algorithms, technical and operational specifications that brings most up-to-date clinical and public health and data recommendation to ensure that we are operating and in the digital ecosystem, and all these digital ecosystems are leveraging on WHO guidelines to ensure that we bring those benefits to all. With that, in closing, I want to thank both the UNICEF, UNFPA, PATH, and the Health and Reproductive Program, HRP, and also the Digital Health and Innovation Department, as well as colleagues that have worked on the digital implementation investment guide for bringing this to life, but also for adding these yet another digital public goods that will hopefully bring and add the value and bring the benefits to all the stakeholders. It is clear that we will continue to work in collaboration and cooperation with everyone to ensure that we help countries as they embark in this new paradigm of digital health transformations. So I look forward to continue working with all of the stakeholders listed today, but also the ones that are not necessarily listed on this particular guide, to ensure that we all bring the best out of every one of us to deliver the best for everyone in this world, which is health for all. Thank you.
Thank you so much, Bernardo, with your closing remarks. And as moderator, I would like to thank the speakers for the contributions made, and also for the support team to really thank them for making this particular effort possible, and to the viewers for your active participation in terms of making the session very engaging. We hope to engage further in the technical session that is yet to be announced. And so again, thank you. Pleasant morning, evening, and afternoon until we meet for the next session. Session is now adjourned.